If you thought checking only your cholesterol levels during health screenings was enough, that's a deadly misconception. 90% of strokes are caused by atherosclerotic plaques built up inside blood vessels, which can occur even when cholesterol levels appear normal. Every year, 795,000 Americans suffer from strokes. However, recent research reveals that consistently consuming the 10 foods we'll discuss today can clean your blood vessels from the inside and prevent over 80% of strokes. The real mechanism behind strokes. Stroke isn't simply caused by blocked blood vessels. Inflammation develops in vessel walls, where cholesterol, calcium, and platelets stick together forming atherosclerotic plaques. When these plaques become unstable and rupture or break away, they block brain blood vessels causing strokes. Therefore, simply lowering cholesterol levels cannot completely prevent strokes. A comprehensive approach is needed to reduce vascular inflammation, stabilize atherosclerotic plaques, and improve blood flow by decreasing blood viscosity. According to 2024 Harvard Medical School research, consuming specific food combinations can improve vascular endothelial function by up to 40% and significantly reduce stroke risk. First, blood vessel cleaner garlic. Garlic is the champion of vascular health. Garlic's allicin component promotes nitric oxide production in vascular endothelium, dilating blood vessels. Additionally, its strong anti-inflammatory effects suppress chronic inflammation, a major cause of atherosclerosis. University of Erlangen research in Germany found that groups consuming 2 garlic cloves daily for 12 weeks showed an average 7% reduction in carotid intima media thickness. This means blood vessel age actually became younger. When consuming garlic, crush it and expose to air for 10 minutes. To maximize allicin production, raw garlic is more effective than cooked, but those with sensitive stomachs should lightly cook it. Second, blood flow improver fatty fish. Fatty fish like mackerel, sardines, tuna, and salmon rich in omega-3 fatty acids are crucial for vascular health. EPA and DHA inhibit platelet aggregation and reduce blood viscosity, preventing blood clot formation. Japan's National Cerebral and Cardiovascular Center's 20-year follow-up study found that groups consuming fatty fish 3 or more times weekly had 35% lower stroke incidence rates. Ischemic stroke prevention effects were particularly notable. Fatty fish should be steamed or eaten raw, rather than grilled to minimize omega-3 destruction. Frozen fish maintains nearly identical nutritional value, so use without concern. Third, vascular purifier onions. Onions' quercetin is a powerful antioxidant that prevents vascular endothelial damage and inhibits atherosclerosis progression. Additionally, sulfur compounds in onions lower blood homocysteine levels, reducing vascular inflammation. Wageningen University researchers in the Netherlands reported that participants consuming half an onion daily for 8 weeks showed 15% improved vascular elasticity. Onions are most effective when eaten raw, but if the spicy taste is overwhelming, soak in cold water for 10 minutes before consumption. Cooked onions, while destroying some nutrients, still benefit vascular health. Fourth, cholesterol cleaner nuts. Nuts like almonds, walnuts, and pistachios are rich in unsaturated fatty acids and vitamin E. These components prevent bad cholesterol oxidation and prevent blood vessel wall damage. Harvard School of Public Health's large-scale research found that people consuming nuts 5 or more times weekly had 30% reduced cardiovascular disease risk. Particularly, walnuts' alpha-linolenic acid significantly lowered vascular inflammation markers. The appropriate amount of nuts is 30 grams daily, about a handful. Eating too many can lead to excessive calories. Raw nuts have less nutrient destruction than roasted ones. Fifth, antioxidant bomb berries. Berries like blueberries, strawberries, raspberries, and blackberries contain powerful antioxidants called anthocyanins. Anthocyanins improve vascular endothelial function and lower blood pressure. King's College London research found that groups consuming 200 grams of berries daily for 12 weeks showed an average 5 millimeters of mercury reduction in systolic blood pressure. This corresponds to a 14% reduction in stroke risk. Berries are best consumed fresh, but frozen berries maintain nearly identical nutritional value. Consuming with yogurt or oatmeal can increase absorption rates. Sixth blood pressure controller: bananas. Bananas are a potassium powerhouse. Potassium eliminates sodium, lowers blood pressure, and relaxes blood vessel wall tension. Additionally, bananas' magnesium relaxes vascular smooth muscles, improving blood flow. American Heart Association research found that people consuming the daily recommended 3,500 milligrams of potassium had 24% lower stroke risk. One medium banana contains approximately 400 milligrams of potassium. Riper bananas have increased antioxidants, so bananas with slight brown spots are better for vascular health. However, diabetics should consume moderate amounts for blood sugar management. Seventh, blood thinner green tea. Green tea's catechins, especially EGCG, have powerful vascular protective effects. They inhibit platelet aggregation and thin blood, preventing blood clot formation. They also prevent cholesterol oxidation, slowing atherosclerosis progression. Tohoku University's 11-year follow-up study in Japan found that people drinking 5 or more cups of green tea daily had 42% lower stroke mortality rates. This clearly demonstrates green tea's vascular protective effects. Green tea should be brewed in 85-degree water for most effective catechin extraction. Water that's too hot increases bitterness and can destroy beneficial components. Eighth, inflammation eliminator: tomatoes. Tomatoes' lycopene is a powerful antioxidant that suppresses vascular inflammation. Additionally, tomatoes are rich in potassium, folate, and vitamin C, comprehensively supporting vascular health. University of Naples research in Italy found that groups regularly consuming lycopene-rich tomato products showed significantly inhibited carotid intima media thickness increases. Tomatoes have 3 times higher lycopene absorption rates when cooked or prepared with oil. Processed products like tomato sauce, tomato juice, and tomato paste also benefit vascular health. Ninth, blood sugar controller: avocado. Avocados' monounsaturated fatty acids lower bad cholesterol and raise good cholesterol. Additionally, rich potassium and magnesium help control blood pressure. Mexico's National Nutrition Institute research found that groups regularly consuming avocados had 50% reduced metabolic syndrome occurrence. Metabolic syndrome is a major stroke risk factor. Avocados are high in calories, so about half per day is appropriate. Adding to salads or making smoothies can help absorb other nutrients too. 10th, blood vessel strengthener: dark chocolate. Dark chocolate with 70% or higher cacao content is rich in flavanols. Flavanols improve vascular endothelial function and dilate blood vessels, increasing blood flow. University of Cologne research in Germany found that groups consuming 6.3 grams of dark chocolate daily for 18 weeks showed average reductions of 2.9 millimeters of mercury in systolic blood pressure and 1.9 millimeters of mercury in diastolic blood pressure. When choosing dark chocolate, check cacao content and select products with minimal sugar or additives. About 20 to 30 grams daily is appropriate. Combination methods for synergistic effects. These 10 foods each have excellent individual effects, but proper combinations can create synergistic benefits. Morning oatmeal with berries and nuts, lunch salads with fatty fish and onions, and dinner dishes. Incorporating garlic and tomatoes can supply vascular protective components throughout the day. Green tea between meals, dark chocolate as snacks, and bananas and avocados in smoothies or salads allow effortless inclusion of all foods in daily routines. Precautions and optimization tips. Several precautions exist when consuming these foods. People taking anticoagulants should consult doctors before increasing garlic or omega-3 rich food intake. Diabetics should monitor blood sugar changes when consuming bananas or dark chocolate. And those with kidney disease need caution with potassium-rich foods. For optimal effects, consume these foods consistently for over 3 months. While vascular endothelial function improvement and inflammation reduction appear short-term, atherosclerotic plaque stabilization requires longer periods. Harmony with lifestyle. Food alone cannot perfectly prevent strokes. Regular aerobic exercise, adequate sleep, and stress management must accompany dietary changes. Particularly, smoking can neutralize all these foods' effects, so quitting is essential. Excessive alcohol consumption also harms vascular health and should be limited appropriately. If this video helped you, please hit the subscribe button, like, and turn on notifications for more health information. I'm cheering for your vascular health.